Hello, everybody. My name is Travis Love. I am a community engagement specialist with Research with a Heart. I'm here with Dr. Swaminathan, and we're going to talk with the researcher about some common questions that we hear out in the field regarding COVID-19 as well as vaccines. How are you doing, Dr. Swaminathan?
I'm great. How are you doing, Travis? And thank you
Oh,
for having me. It's great talking to you.
it was good talking to you too. Your hair looks great.
Oh, thank you.
So first question, can you tell us about the pause of the J&J vaccine and why it was lifted?
Sure. The J&J vaccine was briefly paused for all of 10 days because there were some reports of particularly women 18 to 48 years old, who had some unusual type of blood clots. Because they noticed some unusual events, the process and the system worked. When we see a problem, we say, okay, hold it, let's pause, let's gather information, let's see what's going on. And after looking at all the cases, they figured out that there were about 1 in a million cases who had some unusual blood clots. Now, initially, we didn't quite know how to look for them, how to treat for it. And now that we know these are the facts. These blood clots, if they occur, are extremely rare. It's about 1 in a million. Secondly, they typically present within the first week to 2 after getting the J&J vaccine, and patients can present with headaches and blurry vision, etc. Now that physicians and healthcare providers are aware of this, we know how to treat this condition so that in the rare event that somebody has the side effect, we know how to treat it properly.
Very cool. Awesome. Thank you for clarifying that. And another question that I hear often is about hesitancy around vaccinations because of the fast way these vaccines were approved. People feel like there was not enough time to really have an efficacious vaccine. Can you help us understand that a little bit better?
Sure. What's important to note is that even though the vaccines appear to have been developed in about a year at this point, because this is the end of April, so just over a year, the science behind these vaccines is years old. Both the messenger RNA technology has been in clinical trials for at least 10 years, if not longer. And the J&J vaccine has been looked at for other infections. In fact, last year, a similar J&J vaccine was approved to prevent Ebola virus. So the science and technology has been there. The only reason the messenger RNA vaccines didn't come into clinical trials, we didn't really have a pandemic that required us to have this new technology come into fruition, because you had effective vaccines available for the flu shot, so it didn't make sense to try and develop something new. Now so we had this basis for about 10 years. When COVID hit, scientists and research communities across the world, we dropped everything that we were doing and really pivoted and focused all our energies and efforts into finding a safe and effective COVID-19 vaccines. Additionally, the US government invested billions of dollars in multiple different companies and vaccine technologies to ensure that the world would have the fastest way to get an effective vaccine. Finally, the clinical trial side, for most clinical trials, we usually enroll participants about 2,000 or 3,000. The vaccines enrolled 30,000, 40,000. So, 10 to 1,000 times more people than you would normally. And lastly, the vaccines were so effective that you were able to prove it in a very short time. And what do I mean by that? If the Pfizer or Moderna vaccine was about 50% effective, it would have taken us a year and a half. Most flu shots are about 50 to 60% effective, which is why it took much longer for those vaccines to get approved. Because these vaccines were so safe and so effective, and like 95% plus effectiveness, we were able to prove within 6 to 8 weeks that they were extremely effective. And at that point, it would be unethical for us to not offer those vaccines to everybody, because because that would be morally wrong and incomprehensible. How can I not give a vaccine that can save lives, save millions of lives, when I know that it's effective? So the benefit outweighed the risk, and at that time, the FDA had no choice but to approve it.
Thank you. That makes sense. That makes a lot of sense, especially the amount of people that actually participated in those trials. Another question that might be a little bit from left field is that there's concerns about fertility from people who get vaccinated. Can you speak to is there any truth to that?
No, I actually had to look it up to find out where these myths and stories are coming from. And it originated from a letter that was written to the European medical agency, sort of our FDA equivalent in Europe, by two anti-vaccine propagandists. And what they did is they used false information to state that the COVID-19 vaccines produce antibodies that might target placenta. Placenta, as you know, is critical to the development of the fetus. That is wrong and completely untrue, but it hasn't stopped people from spreading these false myths. If anything, I will add, there is information to suggest that COVID-19 infection might potentially cause fertility issues, including fertility issues among males. That's being looked at, but that's really why you should get vaccinations, because the infection is more likely to cause problems.
Next question, Dr. Swaminathan, is, are the vaccines effective against the common variants?
So both Pfizer and Moderna have released information that the vaccines are extremely effective against the UK variant. We also have enough information about the South African variant to state that even though the effectiveness of the vaccine may be not like 95%, maybe reduced just a little bit, but it certainly is effective enough to prevent serious infections and, most importantly, deaths from COVID-19 infections.
Okay, well, that's great. And last question of the evening is, there's a lot of talk about might be needing a booster shot for those who have been vaccinated. Is there any proof or truth to that as well?
We are doing, the clinical trials are being conducted right now to specifically answer that question. Based on the amount of antibodies that have been detected among those who were vaccinated, we estimate that there probably should be enough antibodies for about 2 years or so. But that's why we are following all these clinical trial participants, including those who have been vaccinated worldwide, to see how durable or how long this infection lasts. But we don't want to wait to find out, a year later that, oh, you needed a vaccine. So at the same time, the pharmaceutical companies are also conducting studies, developing even more targeted vaccines against these variants in case we do need them as a booster shot later in the year.
Okay, very cool. Well, thank you so much for providing some light on many concerns that come from the community. We hope that you have been able to get some of your questions answered. And if you have more, please send them to Research with the Heart. We love to hear from you, and we love to continue to have this conversation because we think community is essential to the research that we do here at Rutgers, New Jersey Medical School Clinical Research Center, also known as Research with the Heart. Any last words for our people, Dr. Swaminathan?
Now, I would just urge people to get vaccinated. I know there are some people who are just scared to get the vaccines. I will just conclude. I know many of you may be aware about the COVID-19 crisis in India. In fact, the US has announced today that they will be shutting borders next week and only allowing citizens or permanent residents to come from India. I mean, it is really a dire, and it hits close to home, not just because I'm from India originally, but my parents are currently in India. They had to go for personal reasons. I didn't let them go until they were fully vaccinated, and I am so glad that they did, because they are elderly, they have underlying health conditions, and I still remain worried about their health, but I'm only slightly reassured because I know that they are vaccinated. In fact, my dad was diagnosed with COVID a week ago, and thankfully he remains well and completely asymptomatic at home. And I really think that's only because he was fully vaccinated. He only had symptoms for about a day and then has been fine for the past week. That actually shows, that's firsthand about how vaccination can really protect you and your loved ones.
Thank you for that. Thank you for sharing that, Dr. Swaminathan. Until we see each other again, please be good to yourselves and each other. I'm Travis Love. Good night, everybody.
Thank you. Good night.